New York. To talk about this, we are joined by plastic surgeon Dr. Brian Cohen. Dr. Cohen, it's so great to have you here. And the first question is fairly obvious. Which procedures specifically are young people coming to you to receive?
That's a great question, JD. And I think that what we're seeing nowadays is we're seeing more and more young people coming in for breast surgery, like breast augmentation, and we're seeing more and more patients come in for liposuction and body contouring, and that can be men and women these days, especially the under 30 patient population.
So what do you think is driving the increase?
I think the increase is the fact that there's really not a stigmata associated with plastic surgery like there used to be 10, 20, 30 years ago. I think that it's just more in the mainstream these days, and I think that our patients are really out there and they want to feel better and they want to look better. And I think really that's why more and more people are coming in seeking out cosmetic improvement.
Do you think selfies and social media are kind of driving this increase?
I think that selfies and social media are driving a lot of things these days, and I definitely think that there's probably a role that those things are playing with regard to patients coming in for cosmetic enhancement. I mean, I certainly, in my offices in the city and in Great Neck, we're seeing more and more patients come in and they show me selfies. They say, well, do you think that I could make this look better or that look better? And I think that there's a whole host of things that can be done. And I think that it certainly plays a role, but I think that really what it comes down to is the patients that are coming in the door really have an idea that there's something that bothers them, and they think that if they correct that, they can look better and feel better. And I think that's why plastic surgery is such a great field.
Brian, I'm wondering too, in this job market, as tough as it's gotten for people, are these difficult economic times leading young people to say, you know, maybe I can land that gig if I look a little better?
Well, I'm actually not sure if the younger patients are coming in because of that reason, but maybe some patients that maybe a few years older may be coming in because they want to stay competitive. And I think we're certainly seeing some people, but I think it comes back to, you know, the psychology of all of it, that people want to look better and feel better. And I think if you look better and you feel better, you probably will be more competitive in the job market.
So, Dr. Cohen, is there ever an age where it's too young, where you would actually say, no, I'm sorry, I think you should wait a few years before you consider to have this procedure?
I definitely think that there are some patients that could be too, I think that too young is definitely a possibility. I think that, you know, if you have patients that are in their early teenage years, you really don't want to operate on patients until they've, you know, achieved a higher level of growth and more maturity. And you really want patients to be able to accept, you know, the risks and benefits and understand the alternatives to having any kind of surgery. So I think that there may be an age that is too young. And I think that's, you know, one of the things that you have to assess, you know, patient by patient.
Only about 30 seconds, and Doc, I hope this is not too involved a question, but post-surgery, the state of mind of the patients with whom you deal, is it uniformly positive after a cosmetic procedure?
Well, I hope that it is. At least in my practice, I hope that patients are feeling better and looking better, and they have that, you know, post-surgery happiness. But of course, there are times when patients may be a little anxious, they may be a little uncomfortable, but most of the time patients are really happy after they've done something.
Well, Dr. Cohen, we do appreciate the fact that you were able to join us today, and I don't think we're contemplating cosmetic surgery. I probably need radical surgery in that regard, but we sure do appreciate your time checking in from Newsmax, New York. It is great to have you with us, but we've got to clear out because Ed Berliner is waiting in the wings to bring you Midpoint at high noon. We hope to see you back here tomorrow. You know the drill, right? 9 o'clock in the east, 6 o'clock in the west. For now, stay brave, stay free, stay tuned, and thanks for watching.